Hi there, Dr. Hall here, moving on into lecture 16B, talking about other teratogens as listed here on the slide. So we first talked about thalidomide, which was the first recognized prescription drug teratogen. You'll recall that in the 50s and even into the 60s, doctors didn't think that medications could cross the placenta. Obviously, they were wrong, right? So we now know that this is a teratogen. It's a drug that doesn't harm the mother, but does harm the developing fetus if she takes it while she's pregnant. We then talked about the factors that influence whether something can be dangerous to the fetus or not, and if so, to what extent. And the first and foremost question is it something that can cross that placental membrane? Because if it can't, then it can't get into the fetal bloodstream and impact the fetus. But if it can, then we have to ask ourselves, well, what particular effects can that drug itself have? Thalidomide, for some reason, interfered with limb bud development. What type of dose was it taken in, right? So maybe a little tiny bit wouldn't be a problem, but a lot could. And then when is the exposure, right? What is the timing of the exposure relative to which parts of the embryo or fetus are developing at that time? So you'll remember with thalidomide, it was taken to treat morning sickness, which happens early in pregnancy during embryogenesis, specifically most commonly during that time when the limb buds are forming and developing into the arms and legs. And for some reason, this drug affected the arms more than the legs. We don't really know why. So let's move on to talk about some other teratogens, which will also highlight some of these additional factors. So this one is a medicine called DES. It stood for diethylstilbestrol. It's a synthetic estrogen, meaning it was a medication that acts like estrogen, that is made in the laboratory, so it's synthetic. And it was recommended to prevent miscarriage. So for some reason, I'm not sure why, I think they had noticed that women who had miscarriages were more likely to have lower levels of estrogen than women who didn't. And so they thought, well, certainly then if we just give you an estrogen, we can prevent miscarriage. Look at this, recommended for all pregnancies. Routine prophylaxis means everybody should take it as a preventative. Right? So this was aggressively marketed and prescribed for the prevention of a spontaneous abortion, miscarriage, or even premature labor. And these advertisements were in, Ladies' Home Journal and all those kinds of magazines that people used to read back then. So it had been approved in 1947 as a treatment to prevent miscarriage. The way it was used was interesting. So you started taking it at week 6, but at a very low dose. But then by the time you got to the end of your pregnancy, they were taking 125 milligrams a day. So we're going to be looking at the effect of not only timing, but dosage here with this particular teratogen. So what happened to the babies of women who took DES? Well, first of all, in the early 1950s, so a few years after they started marketing it and prescribing it, they were like, you know what, it actually doesn't work to do what we said it would do. But at that time, it'd been out for about 5 years. They're like, but it seems to be safe. No adverse effects were identified. So doctors were like, well, the studies don't prove it's helpful, but we think it might be, and it doesn't seem to be harmful, so we'll just go ahead and keep prescribing it anyway. Right, so this continued to be prescribed through the 50s and into the 60s. And then it wasn't until the 1970s that somebody realized that there were all these young girls and young women who were developing vaginal cancer. Now, vaginal cancer in general is very rare, and it's almost unheard of in young people. It's almost exclusively a disease of female-bodied people in their 70s and 80s, and even then it's rare. So this was very, very strange. So some doctors and some scientists noticed this weird cluster of cases and started studying it and realized that they had been exposed to DES when they were in the womb, right, when they were a fetus. So this was a problem. So this was 1971. This drug had already been out on the market for over 20 years because there was a lag time. When these babies were born, they seemed totally fine and healthy, right? All growing up as children, they seemed totally fine and healthy. And it wasn't until decades later that they started developing problems. And so it was really tricky to figure out, right? Who knows what their mom took when they were pregnant with them, right? Do you know what your mom might have taken? So it was really tricky to figure out. Once they figured it out, it was of course banned for use and withdrawn from the market. But before that happened, as many as 2 million people were exposed. So you might be wondering, is vaginal cancer the only thing that happened to these people? And so it's one of them. So vaginal and cervical cancers. There were also vaginal and uterine anomalies, structural anomalies like with the Mullerian ducts, things that weren't diagnosed until people were teens or young adults, or tried to get pregnant and they were like, oh, your uterus is strangely shaped. Interestingly, too, if you are the daughter of a woman who was exposed in utero, you are less likely to ovulate regularly. So being anovulatory means you're not ovulating regularly. A means without. So it has an effect even then on the granddaughters of the person who took the medicine. Male-bodied people who were in utero when their mothers took DES have an increased risk of hypospadias, which you might remember is when the urethra opens on the underside of the penis, which is kind of more like the feminine pattern of development, right, where the urethra doesn't come out through the glands. Also cryptorchidism, which remember is an undescended testicle. Again, also that's more the feminine pattern of development where you keep the gonads in the pelvis. And hypogonadism, which are words that just means poor functioning of the testicles. So that's really interesting because this was an estrogen type medicine. So you can see how it kind of feminized the bodies of these male-bodied people a little bit. They also are more likely to have gender dysphoria and a transgender gender identity. So a male-bodied person born to a woman who took DES is more likely than other male-bodied people to have a female gender identity. This also potentially makes sense because this is a feminizing medication, right? So perhaps it feminized that part of the brain that's responsible for gender identity. And remember, it was taken late in pregnancy. At the highest doses anyway, right? So these effects that we're seeing make sense because the greatest exposure, the highest dose, was late in pregnancy, right? So later in fetal development, not during embryogenesis. Those doses were really low. So it makes sense that there were no severe, obvious defects in these children when they were born. It was only later we realized there were some more subtle differences and abnormalities. It also makes sense because it was a hormone, right? It was a synthetic estrogen. And so it impacted those parts of the body that are sensitive to sex hormones, right? So the reproductive system and those gender dimorphic areas of the brain that we talked about way back at the beginning of the semester. So DES is infamous to people who are old enough to have known people who were impacted by it, and there are still people impacted by it alive today. It's a tragic story. So you'd think, well, certainly now, right, we know better. We know that drugs can cross the placenta, and we know that they can be harmful. So certainly now we're doing a much better job at protecting fetuses from things that might harm them, right? I love this quote by Maya Angelou, when you know better, you do better. How are we doing? Well, not perfectly. Okay, so there's still lots of things in modern day that we're exposed to that are teratogens. We're going to go through a little list of some. We're not going to discuss all of these in detail, but a few of them. So alcohol is still with us, tobacco, mercury, PBDE, which is a flame retardant, lead is still around, pesticides, and the Zika virus. Now, this is not an exhaustive list. I could fill up the entire slide with things that people are still exposed to that are teratogens, but we're going to talk about some of these. Let's start with alcohol. So the impact of alcohol on the fetus causes something which we have very not creatively called fetal alcohol syndrome. Fetal alcohol syndrome as a syndrome, which causes the effects of some characteristic facial features that I'm going to highlight for you here. So one is that the philtrum, which is that little groove between your nose and your upper lip, is very shallow, right? They don't have much of a groove there. The other thing is that the upper lip is very thin, right? Very thin. The eyes tend to be widely spaced, right? They tend to be pretty far apart, and they tend to have a flat nasal bridge, similar to people with Down syndrome. So we have these, they also tend to have some low set ears, which you can kind of see here. The ears are a little bit lower on the head than you usually see. So there's some characteristic facial features, and then also usually an impaired intellect, sometimes mild, but sometimes severe. What seems to be most problematic is problems with social skills, also communication. But that difficulty with social skills and judgment and understanding what is socially acceptable and what is not results in a 50% chance that someone with fetal alcohol syndrome will end up confined, by which we mean they will end up either in prison because they have broken the law, or they'll end up in an inpatient psychiatric hospital long-term, or drug rehabilitation center. They also are much more likely to be sexually inappropriate with people. Again, they have a lot of difficulty in general understanding kind of social rules and social cues. So at this point, we estimate this probably affects about 1% of children in the United States. It happens in about 30 to 50% of pregnancies where the mother, we know for sure, is drinking more than or much more than 2 alcoholic beverages per day. So it definitely seems to be dose dependent. However, we have no controlled clinical trials to tell us how much alcohol is safe. So that's why you'll see all the recommendations that if you're pregnant, to not drink alcohol at all, because we just have no idea how much is okay and how much might cause what can be these really devastating impairments in the child. So one last thing before I kind of move off of this slide is that this syndrome, in terms of the facial features, the impaired intellect, the difficulty with social norms, has been noted throughout history. Actually, in the time of Aristotle, people talked about it. But unfortunately, they didn't realize it was due to alcohol. They thought it was just due to poverty. And alcoholism and poverty do overlap quite a bit, so we can see how that might happen. But so we've known about this syndrome forever, but we didn't know that it was due to alcohol until the 1970s. So it took us a really long time to figure that out, right? So many people drink alcohol, right? Again, for so long we thought toxins couldn't cross the placenta. Boy, were we wrong. So there's some media assignments for you to watch that are also posted in Canvas. And this is some summary information with a little bit more of the details that you can pause to fill in your notes if you need. So that's fetal alcohol syndrome, and that kind of shows us a couple of things. The example of alcohol, one is the effective dose, although we don't know what dose is safe. Also the fact that alcohol seems primarily to affect the brain, and aside from some facial features, not much else, right? So it depends on what the drug will do. And it also just kind of highlights, again, for how long we had no idea what was happening right underneath our noses. So now we're going to talk about mercury. Mercury is a heavy metal, and we first realized that it could be dangerous when there was an outbreak of Minamata disease in Minamata Bay, Japan. So this was a fishing village located on a bay, obviously, and in the 1950s, all of a sudden, people started getting really, really sick and dying, having terrible neurologic problems. And at first, they weren't sure what the cause was. And then they realized that upstream from the bay, there was a manufacturing plant located along a river that had been dumping their mercury polluted waste into the river. And what was happening is that that mercury was traveling down into the bay and was getting into the food chain. So that then the fish that the people were eating was heavily contaminated with mercury. So Minamata disease was devastating. Many, many people in this village died. It was the first time we really understood that mercury poisoning could happen through fish, right? And through something that we're going to talk about called bioaccumulation. So now you're like, well, Dr. Hall, that's not a teratogen, right? That's a direct toxin. So yes, Minamata disease was the direct toxic effect of people eating fish with high levels of mercury. But the other thing that happened is that there were some women at the time who were pregnant who ate some of the fish, but not enough to get sick, so they were fine themselves. But when their children were born, oh, you can't see it. There we go. So when the children to these women who were pregnant at the time that the disaster occurred, when the children were born, they had significant problems with their nervous system in the way they controlled their muscles. So it looks a lot, clinically, it looked a lot like cerebral palsy. So here we're seeing an image of a woman bathing her son. This is a traditional Japanese bathtub. They're smaller and deeper than what we tend to use, right? But you can see these kind of muscle contractures, so kind of very much like somebody with cerebral palsy. So we know that mercury can act like a teratogen, right? You see his mother is totally fine in this image, and that it primarily impacts the nervous system. So this is just the details on that story. Let's talk for a minute now about this concept of bioaccumulation. So where does mercury come from in the first place? So there are some natural sources of mercury. So mercury is normally down deep in the Earth's crust. It's normally not on the surface, not in the topsoil, but volcanic eruptions can spew actually quite a bit of mercury out into the environment. But then there are human activities that bring mercury out into the environment as well. So coal has a lot of mercury in it, right? And we're mining it from deep in the earth. There's a lot of mercury in it. And when we burn coal, the mercury actually gets vaporized and comes out through those smokestacks. So when we have a coal burning power plant, which we did at Stout until fairly recently, they just shut it down, mercury is released and vaporized out into the environment. That mercury then, that is kind of floating around in the air, will fall down to the earth, especially during rain events, and enter the watershed. Additionally, when we mine, right, when you think of those mountaintop removal mines and things that we do, that also releases mercury up onto the Earth's surface. And when it rains, all that mercury gets washed again into the watershed. So the mercury that gets released into the atmosphere and into the surface of the Earth all ends up coming down into our watershed. There, it gets absorbed by the algae, the tiny unicellular plant-like organisms that are kind of the base of the food chain. The algae then get eaten by little tiny fish like krill, and these fish don't have any inherent ability to process or get rid of mercury, so it just accumulates in their bodies. It just gets stored into their body tissues. And then smaller fish get eaten by larger fish, right, who then get all of the mercury from the smaller fish, and then they store it in their bodies, and then they're eaten by bigger fish, and then they in turn are eaten by bigger fish. So what we see is that in fish that are low on the food chain, the overall mercury level is low, but it gets bioaccumulated or bioconcentrated as you move further up the food chain. So fish that are in the middle of the food chain have moderate levels of mercury, and fish that are at the top of the food chain have very high levels of mercury. So this is bioaccumulation of mercury through that food chain. This is that same information in text form. So we know that mercury is toxic to the developing neurologic system, and we know actually in people that have lower levels of exposure to mercury than we're seeing in Minamata, Japan, that those infants, then they're born, have deficits in IQ, attention, memory, and also visual spatial perception. So there's actually quite a lot of data to suggest that ADHD-like symptoms are caused by mercury exposure in utero. We also know that 10% of pregnant women have levels of mercury in their body that are high enough to be associated with these adverse fetal effects, right? So that means about 10% of all the babies that are being born actually probably have some deficits that they would not have had because of exposure to mercury. So for most of us, the way we get mercury exposure is fish, right? So it's the fish in whom it bioconcentrates. So we actually have guidelines for how much fish you can and cannot eat, even here in Wisconsin. So this map over here shows you all the states that do have advisories. So if it's a blue state, they have advisories. The water is polluted with mercury, therefore the fish are polluted with mercury. So if you are female-bodied or a child, right, you can have just once per week, you can have bluegill, crappies, yellow perch, sunfish, bullheads, and trout. Higher up on the food chain, only once per month. Should you ever have walleye, right? Who doesn't love walleye for their fish fry, right? Pike, bass, catfish, and all other species. And you should never, ever, ever eat muskies. They have a lot of mercury in them. So if you're like me and you're not going to have any more babies, or if you have a body type that doesn't allow you to have babies, you still shouldn't eat a lot of muskies because you can get enough mercury exposure eating more than once per month muskies that it can actually cause problems with your own nervous system. And you might think, oh, that totally can't be, my dad eats it several times a week in the summer. And I have diagnosed this, and I had a patient one time, this is when I lived in New York State, he loved sushi. And he started getting this weird tingling and numbness. We couldn't figure it out. Finally, I was like, gosh, this could be mercury poisoning. Checked a mercury level on him. Lo and behold, it was really high. And it was because he was consuming a lot of higher in the food chain fish in the form of sushi. So this actually does happen. So here's some additional readings if you're interested in learning more about mercury. These are optional. This is an article that talked about these ADHD-like symptoms associated with mercury exposure. So mercury is a good example of explaining why the dose is important, and it's also our first opportunity to discuss bioaccumulation of toxins in the environment, and it also helps highlight again that the nervous system seems to be the system that is impacted by this particular drug or agent. So now let's talk about PBDE, which is obviously an abbreviation for a difficult to say chemical name. So it's polybrominated diethyl ethers. I won't ever make you know that. So PBDEs are flame retardants, and they're widely used because fire is serious and dangerous. So most building materials, electronics, furnishings, things like throw pillows, carpets, upholstery on furniture. It's used a lot in cars, airplanes, plastics, polyurethane foams, including the ones that are used for cushions, as well as textiles like clothing. So here I've kind of shown you a picture of some child pajamas, right? And it says low fire danger because they have been treated with PBDE. This is a polyester material. So it's interesting, any polyester material, because they're very flammable, they must by law for children's pajamas be treated with a flame retardant. The only children's pajamas that are not treated with flame retardants, which are usually PBDEs, are the ones that are 100% cotton, which are actually difficult to find. So PBDEs are widely used. They also bioaccumulate, so if you are exposed to them, they just build up in your body. You have no way to really get rid of them. And they're everywhere. So we actually breathe it in. You know that new car smell? Well, some of it's probably PBDEs. We also ingest it, which is to say we eat it. So down here you can see that your animal products, right, things where things can bioaccumulate, are going to be the highest in PBDEs, especially land-based animals. And then we also absorb it through our skin. So if you are wearing clothing that has been treated with PBDE, you are actually absorbing that chemical through your skin and into your bloodstream. So we know that these bioaccumulate in your bloodstream, in your fat tissue. A lot of it gets stored away in your fat, and it also gets secreted in breast milk. We know that people in the United States have levels that are 10 times higher than levels of people in Europe, because in Europe, these substances have actually been banned and regulated much more stringently. We also know, because of their routes of exposure and their smaller bodies, children have levels that are 3 times higher than those in adults. So what I want to show you in this graph here is a couple of things. So first, the red is worldwide production of PBDE. The blue is levels of this material in Arctic ringed seals. So what this tells you is this stuff gets into the air and circulates all over the world, right? But we also have differences in terms of our local exposures, right? If it's allowed to be used to treat your clothing and your home furnishings, you're going to have more than if you're just exposed to whatever's in the air. So this middle one, this green one here, levels in human breast milk. And this was a study done in Sweden. And you can see right here is when they banned the use of PBDEs in products for households, and the levels came down. So depending on where you are and what types of regulation exist, right, you're going to actually have a lot less exposure to these compounds. So what can PBDE do to the developing fetus? Well, decreased mental and physical ability, decreased IQ. There's also some data to suggest that PBDs are endocrine disruptors, right? So they act on our hormonal system, looks like potentially on our thyroid and maybe our reproductive systems. These are hard to study because everybody has this in their body, right? But we know that people who have higher levels have decreased mental and physical function and decreased IQ. So we know that they are harmful. Here's some additional optional readings on those if you'd like to learn more. So the last teratogen we're going to talk about is the Zika virus, and we're going to talk about this because it's an infectious disease that acts like a teratogen rather than a chemical. So Zika is transmitted by mosquitoes, hence the yucky picture on the previous slide. And what's interesting about this infection is that 80% of the people who get it actually have no symptoms. So they don't even realize that they're sick, right? So here's an example of something not necessarily causing a negative impact on the mother, right? But you know, about 20% do get symptoms. They can have rash, conjunctivitis, which is pink eye, joint pains, and fever. But what we know is that Zika virus is a teratogen. It's very dangerous to the developing fetal brain. So what happens is it causes something called microcephaly. So micro means small, cephalic means head, so very small head. And the reason why the head is very small, right, so they're showing you some examples. This is a milder microcephaly, this is severe microcephaly. The reason why the head is so small is because the brain is not fully forming. So what happens in infants who are inside their mother's womb and their mother gets infected with Zika virus, in some cases, is that they don't develop a normal brain. The brain is very small, and so therefore the skull and the rest of the head is very small. In fact, some of these children basically have nothing beyond the brainstem, right? The most primitive parts of the brain only form. So here is an example of a child in Brazil who was born with this condition, has a very small head, and because they're missing so many of these important parts of the brain, these children are typically unable to walk. They're often unable to eat or drink at all by themselves. They need to be fed with a feeding tube. They're unable to talk, and we don't know how aware of their surroundings or how kind of conscious they are. So you might wonder, well, what about coronavirus? Is coronavirus a teratogen? Well, first of all, it's too early to say for sure, but the data that we have thus far indicates probably not. So coronavirus is many things and scary and devastating for many reasons, but at this point it does not appear to be a teratogen, but we probably won't know for sure for some time yet, especially if its effects are relatively mild. So teratogens are substances that don't harm the pregnant woman herself, but cause damage to the developing fetus. We talked about the historical examples of thalidomide, which was taken early in pregnancy and caused severe limb defects in the infants. And then DES, which is a synthetic estrogen taking at high doses later in pregnancy, caused milder abnormalities, but no less dangerous vaginal and other reproductive cancers. We then talked about some modern day teratogens. We talked about alcohol and fetal alcohol syndrome. We talked about mercury and how it bioaccumulates, and so we want to avoid eating fish that are high on the food chain because it causes problems with the nervous system. We talked about PBDE and how it also bioaccumulates, and we saw that example of what can happen if you institute a regulation, right? So when in Sweden they banned the use of PBDE, then levels in their population fell. And then we talked also about Zika virus and how sometimes an infection can actually cause fetal harm. So, as Maya Angelou says, do the best you can until you know better. Then when you know better, do better. So we still have some strides to make in terms of making sure that our environment is safe and that people are not exposed to things that are harming their unborn children. So there's our summary of the things that we've talked about in terms of all types of congenital malformations as well as teratogens. The next part of lecture 16 is going to be about pregnancy.